He may even identify himself with it and believe that he is what he appears to be.
Welcome to the NCE Study Guide. I created this study guide using ChatGPT and Notebook LM. So think of these modules as AI-powered audio flashcards. Each one of these 20 modules contains 10 mock questions representing the kind of questions that you might encounter on the National Counseling exam. I created this primarily for myself, and I decided to make these available to anyone else who might benefit from this kind of study aid. But please note, while I have done my best to ensure that these modules align with NCE content, I encourage you to cross-reference them with trusted study guides and resources for the most accurate preparation. These modules are not affiliated with or endorsed by the NBCC or any official licensing board. And today I'm introducing a new case study module. Now, as you may already know, I took the NCE and I passed it a few weeks ago, but I learned so much from putting these modules together, and I enjoy seeing the downloads increase and hearing from listeners who reach out. So I've decided to take this case study approach to kind of bridge that gap between prepping for the NCE and really getting started as a mental health care professional in the field, really understanding the ethics and the different modalities and the interventions and how would I do a diagnosis for certain situations. So that's what you're going to be hearing in these case study modules. And I also want to remind you that I'm putting together a grassroots study group for anyone who is looking for some real life person interaction as you prep for the NCE, not just these AI puppet shows. So if you're interested, email me at ncestudyguide@gmail.com. So, with no further ado, here are your AI study buddies from Notebook LM. Enjoy.
Nice to be in orbit.
Welcome back to the Deep Dive. We know many of you are gearing up for the National Counselor Examination, the NCE, and, well, we're here to help you prepare.
Exactly. Think of this as case study module 8 out of 10 in our NCE prep series.
Today, we're digging into a resource called the NCE Study Guide.
Yeah, and this guide, it's really designed to bridge that gap between, textbook learning and what you actually need for the NCE, using client scenarios, counseling concepts.
We're making it practical.
Right. More practical, more insightful.
And the creator is Glenn Ostland. Now, he actually just went through the NCE himself.
Oh, interesting. So fresh perspective.
Very fresh. Plus, he has master's degrees in folklore and clinical mental health counseling, and he's been podcasting since 2010, so he knows how to communicate complex stuff.
Right, that makes sense. And his own NCE prep, that's what sparked this whole thing.
Apparently so. He felt there was a need for something more engaging, more research-backed than just rote memorization.
I get that. You need to really understand it, not just memorize facts.
And here's the really interesting part, how he puts it together. He calls it his AI puppet show.
Okay, intriguing. What does that mean?
So he uses ChatGPT to help draft and refine the case studies. Really deep dives into theory, research, ethics.
Okay. Using AI as a writing partner.
Exactly. Then all that info goes into a Google Doc and then into Notebook LM.
Ah, Notebook LM. That's that AI tool that synthesizes information, right? Finds connections.
You got it. So it helps look at the material from different angles, creates this kind of dialogue-rich output that mimics the critical thinking you need for the NCE.
That's actually a really clever workflow, using AI to enhance the learning process.
Yeah, pretty innovative. And hey, if you want more interaction, Glenn runs a weekly study group for listeners.
Oh, cool. Peer learning is so valuable.
Totally. If you want to join or even suggest topics for us to cover, just shoot an email to n6studyguide@gmail.com.
Good to know. Community support makes a difference.
For sure. Okay, so today's focus, Case Study 008. It's titled Linda, the Grieving Widow.
All right, Linda, let's see what's going on.
We're going to break down the case, look at ethics, assessment, diagnosis, theories, interventions, and those all-important key takeaways for the NCE.
And it's some practice questions at the end.
Absolutely. NCE-style questions to test your understanding. Ready to dive in?
Let's do it.
Okay, so Linda, she's 68, retired. It's been about 6 months since her husband passed away. They were married for 40 years.
Wow, 40 years. That's a lifetime. And 6 months post-loss. Okay.
She's coming in with persistent sadness, really low energy, loss of interest in hobbies she used to enjoy, and she cries frequently.
Pretty classic grief symptoms, but the persistence at 6 months is something to note.
Right. Her friends are trying to get her out, socialize, but she says she feels emotionally numb, like she's just going through the motion.
That emotional numbness, that detachment, is often a flag for something potentially more complex than typical grief.
That's what I was thinking. And she's got physical symptoms too. frequent headaches, chest tightness, trouble sleeping.
Okay, the somatic complaints are significant, especially in older adults. We need to keep those in mind.
She denies any suicidal thoughts, thankfully, but she is questioning her purpose now. Says she misses her husband deeply, feels like she's lost her identity.
That loss of identity after such a long, interdependent marriage, that's huge.
Yeah.
It's not just missing the person, it's like the whole structure of her life and self has shifted.
Exactly. Looking at her history, no prior counseling, no known mental illness or substance abuse. Clean slate there.
Good baseline information.
She lives alone. Her kids are grown and live out of state.
So, limited immediate family support nearby.
Yeah. She has a neighbor she talks to, and she's part of a church group, but that seems to be about it for regular social contact.
Okay.
And she describes the marriage as deeply loving and, importantly, very interdependent.
Interdependent. That word really stands out. Suggests they relied heavily on each other, perhaps for practical things as well as emotional support, makes the adjustment even harder.
Definitely. Okay, so that's Linda's situation. Let's pivot to our first NCE focus area. Ethical considerations.
Right. Always ground zero in counseling. What ethical issues jump out here?
First up, informed consent. It's absolutely crucial we clearly explain everything to Linda up front.
Like what?
Well, the goals of grief counseling, what the process actually involves, her rights, confidentiality, limits, her right to stop anytime.
Absolutely. Especially when someone's feeling vulnerable, like Linda probably is, transparency builds trust.
Totally. Then there's age-appropriate practice. We need to be sensitive to the fact that Linda, at 68, might have different views on mental health or expressing emotions than, say, a younger client.
Good point. Generational differences are real. We can't assume she's comfortable talking openly about everything right away. We need to respect her pace and style.
Avoid making assumptions, basically. Meet her where she is.
Exactly.
Okay, third one. Referral and coordination. Those physical symptoms, headaches, chest tightness, insomnia.
Yeah, can't ignore those.
Right. While they can be grief-related, we have an ethical duty to consider if there's an underlying medical issue. We need to monitor them, maybe suggest she sees her primary care doc.
And if she does, collaborating with the doctor, with her permission, of course, would be important for holistic care. That mind-body connection is key, especially later in life.
For sure. And finally, cultural sensitivity. We need to honor Linda's potential spiritual beliefs, her generational values about loss, resilience, maybe even privacy.
Her church involvement might be a clue there. Understanding her spiritual framework could be really important for finding meaning and support that resonates with her.
Absolutely. Okay, let's move into assessment and diagnosis, another big NCE area.
This is where we start putting the pieces together clinically.
The study guide suggests a few assessment tools. First, the Inventory of Complicated Grief, ICG.
Yes. Specifically designed to screen for prolonged grief disorder. Helps differentiate typical grief from something more impairing.
Exactly. Then there's the Geriatric Depression Scale, GDS.
Good choice for Linda's age group. It's tailored for older adults.
Right.
Catches depression symptoms that might present differently, maybe more somatically.
Precisely. Using an age-specific tool is better practice. Avoids potential misdiagnosis from standard scales.
Makes sense.
And, of course, the foundation, the clinical interview.
Can't beat a good conversation. That's where you get the nuance, the story.
Digging into the grief timeline, her coping mechanisms or lack thereof, her overall functioning since the loss, getting her narrative.
That qualitative data is just as important as the scale scores.
So based on all that, the 6-month duration, the numbness, the functional decline, the somatic issues, what's the likely primary diagnosis?
Well, it really points strongly towards persistent complex bereavement disorder, which is now officially prolonged grief disorder in the DSM-5-TR.
Yeah, the key criteria seem to fit her presentation quite well, but we need rule-outs too.
Always. What are we considering?
Major depressive disorder is a big one. Could it be comorbid grief and depression? We'd need to watch for worsening vegetative symptoms, like appetite or sleep changes, or pervasive anhedonia.
Right. Differentiating that deep sadness of grief from the specific symptom cluster of MDD is critical.
Also, adjustment disorder with depressed mood. Maybe if symptoms were less severe or more recent, but her level of impairment seems beyond typical adjustment disorder.
Yeah, adjustment disorder usually implies the symptoms will remit within 6 months after the stressor ends, or in this case, after the loss. Her symptoms are persisting.
And we always have to rule out normal grief. While her sadness is expected, the intensity, the numbness, the functional impairment, it suggests something beyond a typical grief trajectory.
Exactly. That feeling of being stuck, the emotional numbness, the difficulty re-engaging with life, those are the differentiators pointing towards prolonged grief disorder.
So the key formulation insight is that her specific symptom cluster, somatic issues, functional decline, numbness strongly suggests prolonged grief disorder.
Right. It ties everything together, her history, symptoms, assessment, into a clinical picture that guides treatment.
Okay, let's talk theoretical approaches. How might we frame our work with Linda?
Having a theoretical map helps guide our interventions, doesn't it?
Definitely. The guide suggests starting with grief counseling, specifically Worden's tasks of mourning.
Ah, Worden. A very practical, task-oriented model. Why use this with Linda?
Well, it breaks grief down into manageable steps, right? 4 tasks. Accept the reality of the loss. Work through the pain.
Okay.
Adjust to the world without her husband.
Crucial.
And finally, find an enduring connection with him while still moving forward with her own life.
It frames grief as active work, not just passive suffering. That can be empowering.
Good point. Another approach, narrative therapy.
Interesting. How does that fit with grief?
It's about the stories we tell ourselves. Narrative therapy would encourage Linda to, well, tell the story of her life and this loss and then maybe reshape it.
Reshape it how?
To integrate this 40-year marriage into a new chapter, a new sense of identity, not erasing him, but finding a way to carry the meaning of that relationship forward into her changed life. Reauthoring her story.
Making meaning out of the loss, finding continuity. Yeah, I can see that being very helpful, especially with that identity piece she mentioned.
And the third one mentioned is Gestalt Therapy.
Gestalt focuses on present awareness, emotional expression, unfinished business. How does that apply?
It could help facilitate emotional expression, particularly if there's unfinished business. Things unsaid, maybe regrets, techniques like the empty chair exercise.
Right. Empty chair. Powerful tool for bringing those unresolved feelings into the present, allowing for expression and maybe some closure.
Right. Could be very useful for working through stuck emotions.
Okay, so we have Worden for structure, narrative for meaning and identity, and Gestalt for emotional processing. Good options.
So now let's translate these theories into specific interventions. What do we actually do?
Okay, boots on the ground. What happens in the therapy room?
In the early phase, first things first. Normalize grief reactions. Let her know the sadness, numbness, confusion, it's all part of the territory.
Validation is so key early on. Reduces feelings of isolation or thinking something's wrong with how they're grieving.
And provide psychoeducation. Maybe explain Worden's tasks or the general stages of grief. Gives her a framework.
Knowledge can be empowering. Help her make sense of the chaos.
Absolutely. And fundamentally create that safe space. Just listen. Let her share memories. Talk about the relationship, the rituals, its significance.
Just bearing witness. Sometimes that's the most important thing you can do initially, allowing her to honor the past.
We could also suggest some activities outside session, like journaling or maybe writing letters to her husband.
Expressive writing can be really helpful.
Yeah.
A private way to process difficult emotions, continue that bond in a new way.
Okay, moving into the middle phase, we could start focusing more on narrative reconstruction.
Building on that narrative therapy idea.
Exactly. Helping her explore what she learned from the marriage, how it shaped her, and start thinking about her identity now. Integrating the past into the present.
Finding that continuity, building a bridge to the future.
We might also introduce a Gestalt intervention, like the empty chair, if it feels appropriate and she's willing to work on any unresolved feelings.
Could help release some of that stuck emotional energy.
And gently, carefully encourage social reconnection. Not pushing, but exploring possibilities like her church group or maybe other community things at her own pace.
Yeah, gradual re-engagement is important to combat withdrawal, but it has to feel safe for her.
And continue psychoeducation. Maybe talk about complicated versus normal grief, the mind-body link with her physical symptoms, or the role of meaning-making and healing.
Deeper understanding can foster acceptance and active coping.
So how do we know if therapy is working? What are the indicators of progress?
Good question. What should we look for?
Maybe seeing her engage more in daily activities again, a reduction in that emotional numbness.
Okay, more presence, more connection to the world.
Being able to talk about her husband with both sadness and warmth, not just pain, shows integration.
Right, holding both the loss and the love.
And seeing her reconnect with her community, maybe even finding new roles or interests.
Signs of adaptation, of building a new life while still honoring the past. Those make sense.
All right, this next section is super important for everyone studying. Key takeaways for the NCE.
Okay, distilling it down. What absolutely needs to stick for the exam?
Number 1, understand grief in older adulthood. Know the difference between normal grief and prolonged grief disorder. Linda's case is a perfect example.
Definitely. Know the criteria, know how it might look different in older clients.
2, know your assessment tools. Remember the ICG for prolonged grief and the GDS for depression in older adults. Know why you'd use them.
Right. Appropriate tool selection is key.
3, integrate spiritual and cultural values. Remember Linda's church connection. Being sensitive to these factors is crucial for effective ethical care.
Cultural competence is always a major theme on the NCE.
4, know how counseling theories apply to grief. Think Worden, narrative, Gestalt. How do their principles and techniques help someone like Linda?
Linking theory to practice. Essential.
And 5, remember those ethical considerations for older adults, especially monitoring physical health and coordinating care.
Ethics and age-specific issues.
Got it. Okay, ready for some NCE-style review questions based on Linda?
Let's test ourselves. Hit me.
Question 1. What is the most likely clinical concern for Linda based on the case? A, acute stress disorder. B, persistent complex bereavement, prolonged grief disorder. C, generalized anxiety disorder. D, obsessive compulsive disorder.
Okay, thinking about the 6-month mark, numbness, functional decline, it feels like B.
B, persistent complex bereavement, prolonged grief disorder is correct. Her symptoms, especially duration and numbness, align best with PGD, not ASD, too soon after loss, GAD, worry isn't the primary feature, or OCD.
Makes sense. Question 2. What is a key ethical concern when working with older adults like Linda? A, requiring medication for grief. B, assuming cognitive decline. C, monitoring physical symptoms and referring if necessary. D, using behavior contracts.
Ethical concerns specific to older adults. Those physical symptoms seem important. I'll go with C.
C, monitoring physical symptoms and referring if necessary is the best answer. Somatic complaints can mask medical issues, so referral coordination is key. Requiring meds is out of scope, assuming decline is biased, and contracts aren't the primary concern here.
Got it. Question 3. Which assessment tool is most appropriate to measure Linda's depressive symptoms? A, Beck Depression Inventory 2. B, PHQ-9. C, Geriatric Depression Scale. D, MMPI-2.
We talked about this one. For older adults, gotta be C.
C, Geriatric Depression Scale is correct. It's specifically designed and validated for assessing depression in older populations, accounting for age-related symptom presentation.
Makes sense. Question 4. Worden's model of grief includes which of the following tasks? A, repress emotions. B, detach from the deceased. C, find a way to remain connected while moving forward. D, eliminate all reminders.
Worden? It wasn't about detaching completely, was it? More like integrating, so C.
C, find a way to remain connected while moving forward is right on. That's the final task, finding an enduring connection while embarking on a new life. Repressing, detaching fully, or eliminating reminders aren't Worden's goals.
Okay. Question 5. Linda writes a letter to her deceased husband to express feelings she never shared. This intervention is aligned with A, solution-focused therapy, B, Gestalt therapy, C, psychoanalysis, D, cognitive therapy.
Letter writing, expressing unfinished feelings. Sounds very Gestalt.
B, Gestalt therapy is correct. Techniques like letter writing or the empty chair are characteristic of Gestalt, focusing on present experience and resolving unfinished business.
All right. Question 6. Which of the following would be a culturally sensitive intervention for Linda? A, suggesting immediate return to dating. B, validating her spiritual beliefs about the afterlife. C, discouraging mourning behaviors. D, ignoring her values to remain neutral.
Cultural sensitivity. Respecting her world. B seems like the only one that fits.
B, validating her spiritual beliefs about the afterlife is the culturally sensitive approach. It acknowledges and respects her worldview, which can be a source of strength. The others are insensitive or dismissive.
Okay. Question 7. What would be a red flag indicating depression rather than grief? A, occasional sadness. B, desire to avoid social events. C, persistent anhedonia and hopelessness. D, talking about memories of her spouse.
Differentiating grief and depression. What's a key sign of MDD, that pervasive lack of pleasure or hope?
C.
C, persistent anhedonia and hopelessness is the correct answer. While sadness, A, and withdrawal, B, occur in grace, persistent anhedonia and hopelessness are more specific indicators of major depressive disorder potentially co-occurring with grief. Talking about memories, D, is normal in grief. Got it. Question 8. What is a core focus of narrative therapy in grief counseling? A, erasing memories of the deceased. B. Identifying faulty logic. C. Reauthoring the client's story to include the loss. D. Teaching social skills.
Narrative therapy, it's about the story, right? Rewriting it. C.
C. Reauthoring the client's story to include the loss is the core idea. It's about integrating the loss into the ongoing life narrative in a meaningful way, not erasing memories. A. Focusing only on logic. B. More CBT. Or teaching social skills. D. Different focus.
Makes sense. Question 9. Linda frequently says she has no reason to get up in the morning. What existential concern is likely present? A. Death anxiety. B. Freedom and responsibility. C. Isolation. D. Loss of meaning and purpose.
No reason to get up. That sounds like a crisis of meaning. D.
D. Loss of meaning and purpose is the most fitting answer. The loss of a long-term partner often triggers existential questions about one's role, identity, and reason for being.
Okay, last one. Question 10. A marker of progress in grief counseling would be A. Never crying. B. Avoiding memories. C. Engaging in new roles or relationships. D. Minimizing the impact of the loss.
Progress. Not avoiding feelings or memories. Probably engaging with life again. C.
C. Engaging in new roles or relationships is a positive marker of progress. It shows adaptation and re-engagement with life while still holding the memory. A, B, and D suggest avoidance or suppression, which isn't healthy adaptation.
Whew. Okay, those questions definitely hit the key points from Linda's case.
Yeah, a good way to check understanding and see how these concepts might appear on the NCE.
And remember, if you want more practice and discussion like this, check out Glenn's weekly study group. Email NCE-studyguide@gmail.com.
Great resource. And send us your ideas for future topics too.
Absolutely. So as you keep studying, think about how you can apply different theories to understand a client like Linda. Consider all the angles: ethical, cultural, developmental. That multifaceted thinking is what the NCE and good counseling is all about.
1, 2, 3.
Nice to be in orbit.